focusing on women, from the essential screenings at every age to the questions you should be asking at your next checkup. Dr. Thais Ali-Abadi is a board-certified OBGYN, and the doctor, actress Olivia Munn, credits with the early detection of her breast cancer. And we've had Olivia here talking about that a lot. Dr. A, as your patients call you, nice to have you here with us.
Thank you for having me.
I mean, let's start about women's health. I mean, a lot of people think, well, I went and I got my annual exam and that's it. There's a lot more to it.
Yes. People think if they get a pap smear, then they're done with their annual exam. And that's just one page of an entire book. When we talk about an annual well woman exam, we need to address breast health, pelvic health, fertility, hormones, bone health, risk of cardiovascular disease, risk assessment for genetic testing, for cancers. So it's a very comprehensive visit. And we can't just summarize that by talking about a pap smear. It would be really doing injustice to women.
Well, let's go, because it changes by every age. If you are in the reproductive age of your life, what are some of the tests that you need to have?
So the most important thing I would start talking about is there are two conditions that are the top causes of infertility in women: endometriosis and PCOS. Majority of patients go through life not getting diagnosed. So you don't want to miss those symptoms. For PCOS, irregular periods, facial hair, body hair, acne, hair loss, weight gain that doesn't respond to diet and exercise, mood changes associated with it, eating disorder. These are all under the umbrella of PCOS. And endometriosis patients usually have painful periods, painful sex, pain with urination. It's all about pelvic pain. And majority of these women are dismissed at their doctor's appointments. So it's important to notice these symptoms and to maybe go to a specialist and make sure that you're not missing these.
So let's talk about breast cancer. We talked about, Olivia Munn, and she, of course, did a test in your office that she credits with saving her life. Most women know, okay, once I'm in my 40s, I need to start getting a mammogram. What else?
So I say, if you know your first name, last name, date of birth, you need to know your lifetime risk of breast cancer. By age 30, everyone needs to know what that number is. It's important because if that number is 20% or more, it puts you in a high risk category for breast screening, which means you can start your breast imaging as early as 30 and not 40. So this, women think until 40, they don't need to do anything. That's false. So you need to know what that number is and start your imaging based on that number. The other thing I always say is by age 25, if you have family history of breast cancer or ovarian cancer, let's say, you have to have a genetic testing. In my office, I do the Myriad genetic test, which checks for 48 cancer-causing genes, and it calculates your lifetime risk of breast cancer. You need to know that information because if you have genetic mutations, then you can start your breast imaging as early as 25.
Trying to get the ultrasound and some of those more detailed images. Let's talk about perimenopause and menopause ages. What should you be checking into there?
As you know, average age of menopause is 51 and a half, 7 to 10 years before menopause, women go through perimenopause. Hot flashes, night sweats, sleep disturbances, irregular periods, mood changes, anxiety, weight gain, joint pain, vaginal dryness, pain.
Sounds like a blast.
I mean, the list goes on and on and on. It's important to recognize these because sometimes it can start late in your 30s. So talking about hormone health, getting your colonoscopy done, bone density, hormone panel, all of these should be part of that well woman exam for a perimenopausal woman.
Let's talk about heart disease. Breast cancer gets a lot of attention. Heart disease is the #1 killer of women. So if you go in for your annual physical, what kind of test should you be getting?
So, in my office, if you come, there are certain labs that are essential. Having a fasting lipid panel is very, very important. But besides cholesterol and HDL and LDL, now you need to know what your ApoB is. ApoB is, imagine a bucket of all the bad lipoproteins in your blood that can make plaque. You need to know what that number is because if you have a normal cholesterol and your ApoB is high, you still need to get treated. You need to know if you have a genetic predisposition to lipoprotein little a, which makes plaques, and 20% of women have that. These are information you need to arm yourself with. By 45, you need to have a coronary calcium scan. You need to know your hemoglobin A1C. You need to know if you're at risk for dementia, diabetes, all of it. And these are simple blood tests that can be done.
Can you be my doctor? I know you've got the Kardashians and everybody else, but you know your stuff. It's great to have you share your expertise with us this morning.
Thank you. Thank you for having me.
Thank you, Dr. Ali-Abadi. And you can find her full checklist to bring to your next doctor's visit on our website on today.com. That's worth printing out. Thank you.